Traditional office settings pose unique challenges when reducing the risk of COVID-19. Due to the larger number of people closer together in cubicles, open floor plans with shared desks or conference rooms, and the extended amount of time spent indoors with coworkers or management. Fortunately, there are essential yet simple protective steps you can take to help keep yourself and others safe. 1. Comply with workplace health and safety policies, which exist specifically to protect you. 2. Be sure to regularly evaluate your and your family's health for signs and symptoms that may indicate COVID-19. If either you or a close family member is sick, talk with your employer about alternatives for you to work from home. 3. Avoid sharing personal items like phones, pens, or staplers. If you can't, disinfect them using a solution with at least 60% alcohol. 4. Ensure that you correctly wear an effective and properly fitted mask while indoors. Curious about how to find an effective mask or how to be sure it fits properly? Click on the link in the description to learn more. 5. When coughing or sneezing, keep your mask on. If you are not masked, either use a tissue and throw it away, or use the inside of your elbow. 6. Always wash or sanitize your hands before and after leaving work, as most public surfaces, like handles and railings, are repeatedly touched by large numbers of people throughout the day. If using a sanitizer, ensure it's at least 60% alcohol. 7. Maintain space between you and others to limit your risk. Check the link below to learn more about other ways to help ensure you reduce the spread of COVID-19 and help keep yourself and others safe at work.